So good morning, good afternoon, good evening. Thank you everyone for joining us. I'm Jenny Miller, the Executive Director of the Global Climate and Health Alliance, and I'm pleased to welcome you to today's webinar, A Healthy Recovery, Charting the Path Forward. So as many of you are probably very well aware, in May of this year, health professionals from around the world sent a letter to the leaders of the G20 countries, calling on them to deliver a healthy recovery in the decisions and plans they make for how we address the economic impacts of the current COVID-19 pandemic. And this included not only investing in our health and public health systems, but also putting us on a path to addressing climate change, air pollution, and the environmental issues that we're grappling with. All of these threats to people's health as an essential part of this, how we come out of the current pandemic. Later this week, the finance ministers of the G20 countries are going to be meeting. And so that makes this a key moment to reiterate that demand from the health community, that these economic investments really take us in a healthy direction and build a healthy and sustainable future. A little bit later in the webinar, before the end of the webinar, we'll share an advocacy toolkit that we've put together with some suggested tweets that can be tweeted at those ministers, a template for writing an email to your leaders and things like that to help support reiterating that call from us, the health community, for a healthy recovery. On today's webinar, we're fortunate to have with us a number of very esteemed speakers and panelists. We have Dr. Maria Neira and Dr. Diarmuid Campbell-Landrum from the World Health Organization. And they're going to talk to us about the connection between the health of the planet, the health of people, and the current pandemic that we're in, as well as what country leaders can do to ensure a healthy recovery. Following that, we'll hear from health economist Carla Guerrero of the University of Naples, and she'll be talking about why protecting the environment and protecting people's health actually makes economic sense. And then finally, we will have the opportunity to hear from a panel of leaders from organizations that signed the Healthy Recovery Letter, talking about why in the midst of a global health crisis, their organizations felt that it was important to send this letter, not only calling on leaders to address the current crisis, but to do so in a way that takes us forward in an environmentally sustainable and healthier direction. So during the webinar, if you wish to post a question or ask a question that we'll then bring to any of the speakers, please note it in the chat. We'll have a little bit of time for one or two questions in response to Dr. Guerrero's presentation about the economics, because I think for many of us on the call coming from the health community, that may be where some real questions come up. So we'll take a couple of questions after her presentation, and then we'll take questions for any of the speakers and panelists at the end of the webinar as a whole. So, but add your questions as we go along by posting them in the chat. I'm now going to turn over to Dr. Maria Neira of the World Health Organization. Maria, please.
Thank you, Jenny, and thank you all, and great pleasure to have again this opportunity to join forces and strategize together on the next steps. I think by now we are all extremely convinced of the opportunity, of the importance of making sure we have the right arguments to propose to our so-called leaders, the ones who are at the moment influencing the stimulus packages and those investments in the direction that they will go. And I think as well, we have all the tools for that. And in that sense, as you know, WHO at the moment is very much putting a lot of efforts on handling and managing the pandemic situation, talking with the world leaders for them to take the necessary measures to respond to this acute situation. But it's true as well that we are not just talking and engaging with the world leaders on how to do to spread the transmission of this virus and how to do better on epidemic preparedness and response. But I think it's extremely important for WHO at the same time maintaining the capacity to deliver on other programs. We are seeing, for instance, that the non-communicable diseases programs are really reducing their implementation. We see that the malaria programs are now struggling as well. We see that public health is in another fields is really struggling. So at the same time that we work with countries to ensure that other public basic ones are as well ensure promoting a universal health coverage, as you know, I think we are all convinced that this is fundamental. And the other key pillar, and this is where we have a major responsibility as this group, is ensuring a healthy, green recovery. Ensuring we're before on the same and terrible mistakes that we were having before. We will elaborate by using all the science we had before on environmental health. I think we have been saying for many years now the importance on addressing the environmental determinants of health if we want to respond to the public health and promote and protect the health and not just cure our citizens. And now more than ever, we need to be there when these huge, exceptional, totally without precedent economic recovery packages will be decided. You're absolutely fundamental, and I think this will provide a very strong argument for saying, okay, the health professionals are behind. They are asking you to take the right decisions and stopping to for instance, keep promoting fossil fuels or investing in fossil fuels. The health community is very much convinced that we need to invest on the prevention, and most of the prevention of next pandemics or next crisis will come to by addressing this environmental, so not human and animal health. This triangle needs to be, again, very much respected. So we have the health professionals, we have all the evidence from before on the environmental health particularly, and now to align all of that and to facilitate the health community and the public health community at large messages. In WHO, we did the so-called manifesto that by now I'm sure that you all hear about it, where we promote a healthy and green recovery, and we are giving 6 prescriptions. Very simple ones, a lot of common sense, keeping in mind as well that those prescriptions are very much aligned to promote an economic recovery. We are very conscious that this is not just a question of invest on health and universal health. Prevention is very much as well about an economic and social recovery. The good thing of those prescriptions, the first, as you well know, protecting nature. The second one, ensuring essential services. The third one will be promoting access to renewable sources of energy, the mother sources of energy, and sending the fossils back to where they should be. Cities, how our cities and our urban planning has to be if we want to protect health. And of course, a better, more sustainable food production, food system from the beginning to the end. And the last one is stopping paying for pollution, stopping giving subsidies for fossil fuels that are killing all of us and very much responsible for those, among others, the 7 million premature deaths we have every year caused by exposure to air pollution. With all of that, the good news is that we have to go with the manifesto. We have already the actionables, so very concrete actions linked to the SDGs and indicators and other agendas. So all the arguments are there, the tools are there, the economic argument, which is the one that we need to use very much now, is ready. And an additional thing, what the society is demanding now, the society is very much demanding now, I don't want to be vulnerable again. I want to be more protected. I want to be more, reduce my vulnerability. Jenny, I'm finishing. I am looking at your facial expression and I see that went through my time. So over to you. Thank you very much. I think we have this opportunity and we are not going to miss it if we are all together. Thank you. Over.
Thank you so much, Maria. Yeah, absolutely. The manifesto is a great tool, and it was fantastic to see WHO come out with this, because it really provides a guidance to countries as to how exactly to move forward with this idea of a healthy and green recovery. So now let's turn to you, Diarmid, to hear a little bit more about what those connections really are amongst these issues. So over to you.
Thanks very much, Jenny. Thanks for the invitation to speak to you all. So just to lead off from the broad introduction that Maria has given, and just to underscore again why these connections are so important. We basically have two arguments we've been making from WHO and from our partners for a long time now on climate change and health. The first is that everything is at stake in health terms if we don't protect the climate and the environment. And that ought to be obvious if we think about it just for a minute. If we don't protect the natural environment and the ecosystem services that the natural environment provides to us, it's impossible for us to have clean water. It's impossible for us to have adequate supplies of food. It's impossible for us to maintain air quality. And so that's why we've been so clear from the WHO side that, as Maria has said, we do have to improve our pandemic response. We do have to improve our provision of public health services. But unless the recovery from COVID-19 protects the natural environment and maintains a stable climate, then all health is basically off the table. We're already seeing the damages that are coming from disrespecting the natural environment. And we know, for example, that this pandemic and all of the other recent major pandemics that we have had have been, it seems, originated from the natural environment. And many of them have been associated with environmental degradation. We've seen that the growing seasons of our major crops have started to be constrained because of climate change. We've seen the reductions in availability of fresh water. And so that's the first point that we make, that if we're going to be putting into place all of these massive investments that we need to keep economies going, then we're ultimately undermining the future of health unless it's a green recovery as well as a healthy recovery. So that's the first point. And then the second one, and again, this is, Maria has introduced this, is the massive opportunities that come for public health through a green and healthy recovery. COVID has obviously been an absolute public health disaster. We've already lost a lot from COVID. We've lost a lot of lives. We've lost significant parts of the economy. There's significant amounts of money. Jobs have been lost. It's been an absolute disaster. The one thing that we should be trying to take away from this is that it has also given us a glimpse into a potentially cleaner, healthier future. And although the lockdowns have been very painful, if you ask people around the world what they consider about the lockdowns, they did appreciate the improvements in air quality. They did appreciate the cleaner and safer environment to walk and cycle, to work for their children. So the trick that we have to manage is to hang on to those good things and to promote those good things as we put into place the money that in order to get the economy moving, to protect livelihoods and so on. And just to take a couple of those points, to elaborate a little bit on a couple of the points that Maria has made. If we're going to be putting trillions of dollars in COVID recovery packages, then we should be investing in the basic public health services. So healthcare facilities that have water and sanitation, that have clean energy access, and that don't fall down when you get a hurricane. If we're going to be putting money into providing energy supplies, we should be putting it into the clean energy supplies, not the, as Maria has rightly put it, the fossil fuels of the past, which are a large contributor to the 7 million annual deaths from air pollution that we have. And finally, that we are going to be investing a lot of money. We are investing a lot of money. A lot of taxpayers' money is going into these recovery packages. Money is tight. And the last thing you want to do is to carry on spending taxpayers' money subsidizing polluting fuels. And so we often quote the figure that fossil fuels receive about $400 billion a year in direct financial subsidy. But if you take into account the damages to health and the environment that they are not paying for, if you like, the cost that is borne in our lungs and in the health of our children and as well as the environment, then that figure rises to over $5 trillion a year. And that's more than all governments around the world spend on health. So we can't accept the argument that times are tight, we don't have, we need to get the economy moving, we don't have time for environmental protection. It's the opposite, because at the moment we're spending vast amounts of public money and also our health on propping up these polluting energy sources. And finally, that's why it's so important, why as WHO we were so happy to see the Healthy Recovery letter. The fact that 40 million, or organizations representing 40 million health professionals have made this their fight as well is critically important. Partly it's the numbers, but even more important than that, it's who those organizations are and who they represent. Because the role of health professionals, they have no other real role other than to protect people's lives and health. They're neutral, if you like, in the climate and environmental discussion. But the fact that that massive organization, that massive community has recognized this and made it their fight is critically important. And the final point is the public knows this as well. We often quote this, that health professionals are the single most trusted profession in the world. So it matters massively when doctors and nurses from around the world say we think this is critically important. So that's basically what we wanted to say is between Maria and myself by way of an introduction, and we're super pleased to carry on working with you and to carry on this discussion, because as Jenny has alluded to, at the moment it's not necessarily going in the right direction. Large proportions of the economic recovery packages that have gone in so far are not going to clean fuels, they're going to polluting fuels. So I'll stop there and hand back to Jenny. Thank you.
Thanks so much, Diarmid. And I woke up to headlines today in the United States that also indicated that environmental regulations are being rolled back under the guise of addressing the economic recession. So that's another dimension of this. As the health community, we've started making this case that these economic recovery packages really need to invest in health and invest in a sustainable future. And we're seeing what the impact of a health crisis has done to the economy so far. And so there's a kind of an intuitive obviousness about the importance of health and sustainability to the economy, but not in any way to disparage either Diarmid or Maria or any of the rest of the health community, but we are not economists. And so we thought it would be useful to actually hear from a health economist on this webinar and hear from an economic perspective what these issues look like. It makes intuitive sense to us from the health community, but does it make economic sense to invest in health, invest in the environment, invest in sustainability? So to get a perspective from an economic point of view, I'm going to turn now to Dr. Carla Guerrero to talk to us from that perspective. Carla.
Thank you very much, and good evening to everybody. Thank you for inviting me. What I'm presenting today is actually the results of a comment that we published on Nature Sustainability together with Marco Pagano, who is a professor in finance. And quite famous in finance, and Andy Haynes, who is an epidemiologist. So we try to promote an interdisciplinary work with some proposal on how to sustain and promote health and sustainability in the post-pandemic economic crisis. So if you can turn to the next slide. So if we look back at the previous economic crisis, 2008, 2011, and 12, actually this crisis is completely different because this crisis has been designed to save health. So in the previous economic crisis, after a slowdown of the economy, we have observed an emission rebound, polluting emission rebound. So we don't want to observe the same during this economic crisis. Also because compared to the previous economic crisis, this economic crisis have seen, we have spent massive public resources, as Dermot was saying, to save lives. And so we have actually sacrificed a very large share of output and employment to protect the health of our citizens. We are still currently doing that in Italy and in other parts of the world. So actually in all the countries with different time, now even in US is recognized the importance of protecting life, and health is a national priority. So we don't want to jeopardize all the efforts that we have done so far, because we have invested so much. We don't want to waste these economic resources that we invested. So how we can do that and don't repeat the mistakes of the past? So well, clearly the first thing is actually to build a resilient healthcare system, as Maria was suggesting, which is the first most important thing, because we want to be prepared for future economic crises. But the other two complementary ways that we promote for a green, healthy, and just recovery are very simple. The first one is to remove subsidies that are actually harmful for the health and the climate. And at the present, we know that fossil fuel subsidies remain very high in many countries, and they actually exceed the subsidies that are invested in renewable. Although we are in a wonderful time, because we now know that clean energy is very competitive. So if we look only at the economic point of view, actually now investing in clean energy, photovoltaic, solar system, well, they actually are cheaper than fossil fuel source of energy. So there is no economic reason not to invest in them. And we know that if we invest in clean energy, we can actually save lives and save money that we invest in saving those lives. So it's very, well, there is a strong economic reason actually to invest in clean energy, even from a pure economic point of view. According to the International Monetary Fund, if we lower CO2 emission by 28%, we will lower pollution-related deaths by 46%. And we also, but the main problem now is that we are already observing environmental damaging bailouts. For example, in the aviation sector, in the oil sector, even Norway, which is a very rich country, has delayed oil gas industry taxes. So as we were suggesting before, actually bailouts are already occurring because of the lobby pressure, and we have to prevent them because they are very cost ineffective from an economic point of view. The second point we propose is actually new, because we look back at the previous economic crisis and what was the reaction from an economic perspective to save the firms in order to recover them. So in the previous economic crisis, actually, we observe a liquidity injection. What is a liquidity injection? A liquidity injection is, for example, during COVID, a lot of firms actually, they observe the revenue drop or disappear altogether because they actually didn't sell any goods and they didn't produce any things. But the problem is that liquidity alone, so giving loans to these firms, doesn't keep the patient alive. It just hydrates him, let's say in a medical term, but it doesn't save him, because after this initial liquidity injection, the firm will actually go out even more indebted, and this won't allow them to survive. And this is what we observed in the previous economic crisis. Actually, economic slowdown not immediately after the recession, after the crisis, but it was diluted in time. So in the medium term, what we are observing and what is actually occurring by now at national and supranational level, and this is actually one of the things discussed at the moment in the Recovery Fund at the European Commission level, is actually the need for an equity injection. Equity is the money value of a business. So it's not only the liquidity, but also, for example, the building owned by the firm, the equipment, furniture, fixture, vehicles, all the assets of the firm. So equity is different from liquidity. So what are doing the government right now? They are injecting liquidity in firms, entering most of the time also in the property of these firms, in order to save them, in order to ensure that, you know, the patients remain alive in the future. So we are observing this phenomenon also at the moment during the COVID crisis at national level, and is being debated at supranational level. So what we propose, if you can move to the next slide, is to actually direct this equity injection also using environmental and health standards. And this is something that has not been done in the past, and we can propose right now, because it's something very easy. So what we propose is actually to establish criteria to identify which firm should be recapitalized with taxpayer money at national and also supranational level, for example, at the European level. So we propose two criteria. The first one is clearly economic viability. So we clearly need to invest in firms that present good profits before the crisis, firms that didn't receive previous state aid, and so forth. But the second criteria, which is completely new, is actually to inject this equity, which is paid with our own money, on firms that meet some environmental, health, and social responsibility criteria. These environmental, health, and social responsibility criteria have been used for a while. I think they started being used by investment funds in the last 20 years. And the use of these ESG criteria, this is the way they are called in finance, has been increasing over time. If you can move to the next slide, you actually can see how these ESG measures are collected from company public disclosure. So these are collected by external rating body, for example, Thomson Reuters, Morningstar, which are currently used in finance to rate firms' profitability. And they are based on environmental, governance, and social standards. For example, environmental can be emission, investment in circular economy, resource use. Governance can be, you know, what's the share, how the share are distributed to employees, or social, whether or not the firm respects human rights, whether the employees receive a fair income from the work. And they are very easy to collect from company public disclosure. So compared to other forms of economic evaluation, for example, cost-benefit analysis, that take into account the emission and also the health-related cost, ESG scores are very, very easy to collect for individual firms, and so they can easily be used to recapitalize firms. If you can move to the next slides, here you have actually an overview of the number of firms that have been scored using ESG standards all over the world. But the number is dramatically increasing over time. And if we actually set ESG as one of the criteria to recapitalize firm, is going to be, you know, for sure the firms are going to ask for this. And this is not going to be costly for the firms, you know, to ask to be rated according to ESG standard. And the nice thing from an economic perspective is that these firms that rated highly in ESG score, they outperform other firms during the COVID crisis. So they should be very resilient to economic crisis, because they, well, we know that, you know, if you invest in, if you are environmental friendly, if you invest in protecting your employees and your employees' health, you actually save money, because you increase also your employees' productivity, you are more competitive towards customers that pay attention to the environment. So we already know that there is an economic reason why this firm should be more profitable. But now we have this score that we can use actually in a very simple manner to to make this information more transparent to the public and also to the body that need to recapitalize those firms. And I'm done. Thank you.
Thank you, Carla, so much. So we do have a couple of questions. We'll just take a couple of questions now so that we make sure we have plenty of time for our panel as well. But somebody asked whether your second recommendation on liquidity and equity, whether there's a way in which that translates to government budgets as opposed to firms, like through debt relief or debt restructuring.
This is a very good question because at the government level, it actually depends on the public debts of the government. For example, in the European context, we have observed that Germany has already created an umbrella to inject equity into the firms of Germany. Because before the COVID crisis, there was a ban for state aid. Now this ban has been lifted. So the countries in Europe can actually provide state aid to their own firm. For example, in the aviation sector, it's been done extensively. And it actually depends on the capacity of the single governments to be able to inject this equity. Mm-hmm. So this is important to do at supranational level.
Yeah, I think this question may be pointing as well towards countries that are that have debt that they're addressing themselves. There's another question that I think might be a question. I don't know if I'll direct it to actually all three of you because there might be sort of different answers from different perspectives. What is your recommendation to a common man on the street about his proactive role in healthy recovery when the fear of making a living is becoming tougher than living? This has become a humongous problem in India and other developing countries. So let me give Maria and Diarmid a crack at that one, and then also give you a shot, Carla. Any thoughts on that?
Is Maria still with us? I was going to defer to her first. I think you're... Maria, did you want to first go?
If so, she's on mute. She may have stepped away for a moment. So why don't you go ahead and start and then... Yeah.
Sure, yeah. I mean, it's a really difficult question, but it's probably the most fundamental question because we often face this, that it's very clear that for anybody, the most important priority, we all know this and public polling will bear it out, everybody's first priority is basically the protection of their family, and second is usually a job to earn a living to protect the family. Health usually comes sort of third after that. So it's completely understandable that in difficult times, people are immensely concerned about will they have a job in order to earn a living to feed their families. And that's even more important in low and middle income countries where there's no margin of error, there's no backup when these things don't go right. I think what is, and we can't get in the way of that. What I think we have to do is to make the longer term case that in many cases, just as Carla has just explained, that solar energy is now cheaper than coal in most places, that it's not acceptable for polluting industries to say, well, you have to give us money because we need to prop up the coal industry because that's the only way you're going to get energy. It's not anymore. It's cheaper to provide it through clean energy sources. In the same way, in most places, as a general term, there are actually more jobs in clean energy than there are in polluting energy. So you have to prop up, you have to take care of the man in the street, the person in the street to make sure they can earn a living. But the long-term vision, particularly for national governments, is to have the courage and to use these investments wisely, because in the long term, the only future is a clean energy future. And in fact, that's where the clean, good paying jobs actually are. So in the long term, it's better for their citizens, but you have to have have the political leadership to make that case and to protect the people in the short term. And that's the challenge I think we're giving to political leaders.
Thank you. I'm actually going to have us move on to our panel now so that we make sure that we have adequate time for our panelists. And then we'll come back. There were some other questions for Carla, as well as broader questions. But we'll come back to those after we hear from our panel. And let me see if I can share my screen. And give you a view of the, here we go. Oops, there we go. So we now will get to hear from a panel of representatives from some of the organizations that actually signed the Healthy Recovery Letter. And so again, the Healthy Recovery Letter was from the health professionals of the world, speaking to world leaders, and representatives from a handful of those organizations are with us today. We have Dr. Fatima Al-Rifai from the International Council of Nurses. She's a board member for the International Council of Nurses. We have the pleasure of having Dr. Mauricio Ilabaca of Colegio Médico of Chile. And we also have Dr. Otmar Kloiber, the Secretary General of the World Medical Association. Joining us from the World Federation of Public Health Associations is Dr. Leticia Rispel, the immediate past president. And then finally, we also have Dr. Richard Smith, who is the chair of the UK Health Alliance on Climate Change, which is an alliance of the Royal Societies of Medicine and Health Professions in the UK. And to lead this discussion, we will be turning back to Diarmid. So now turning over to you, Diarmid, and to our esteemed panelists.
Thanks very much, Jenny. My first job was going to be to introduce the panelists. So thanks for the slide, and it's great that job is already done. I think, if I'm right, we have about half an hour to do this. So what I would like to do, I think we have 5 panelists, is just to maybe give you each an opportunity, just ideally in 2 or 3 minutes, to briefly say why you thought it was so important for your organization, given who you represent, to sign this letter. And then if you could reflect a little bit on what are the most important things you think should be included in the economic plans. And on the converse, what are the things that worry you about, things that could be either missed out or things that could go in there which could be damaging to health in the short and in the long term. So if we could do that, if we could take those same questions basically to each of you, and then we should have enough time either to come back for a little bit more elaboration, or to turn to the audience there for their questions, which I can see are starting to come in the chats and the Q&A. So perhaps we can turn to Fatima first, representing the International Council of Nurses.
Thank you. Thank you very much. You can hear me well?
Very well, thank you.
Yeah. Thank you very much. Greetings from ICN. And as you know, ICN is a federation for more than 130 national associations globally, and we represent 20 million nurses. And so we try to promote nursing and be the global voice for nursing. Our mission is to represent nursing worldwide, advance nursing profession, promote well-being of nurses, advocate for health in all policy. So why did we feel it is important to sign this letter? Actually, we want to make sure that public health and sustainable environment is at the center of the recovery plan. And you know, COVID have made it so clear that the economy really is weak and suffer when human health is compromised. So we think that any health recovery plan should lead to decisions that should reduce pollution and manage climate change. That we know, and research have shown that people in communities where they are living in bad environment and poor quality of air and lack of access to water, they really at high risk to get COVID, and we have seen that very clearly. And we should not forget that with COVID, healthcare professionals have done so great, but they also we have people died and people were really under pressure, whether it's physically or mentally. So that this could have been mitigated by if we had adequate investment in pandemic preparedness, public health, and environmental stewardship. So we, as ICN, calling on government to make sure that pollution level do not go back to previous level, so people can live in healthy environments and climates. And this we think that this can be done if we really focus on public health and climate change within all our plans. So this is why we signed, and we think that there are things that we would like to see in these plans. If you allow me, maybe like 5 quick points. We would like to see strategies to improve public health infrastructure, improve disaster preparedness, response capacities, including, very important, providing protection and support to healthcare professionals. Second, we think that we should use the plan. Plan should very clear to show how to use incentives and disincentives to ensure healthier and resilient societies. And maybe it's very important to make reforms towards production of clean, renewable energy. Also, third, we would like, when the plan is put, to see that there is engagement for healthcare professionals, whether top level or different levels, engaging them in developing strategies, policies for healthy recovery. They know what does it take. They are engaged and they are involved, and they should be really considered. Their point of view should be considered when we look at these plans. So, and we think that government's investment in key sectors, different sectors, whether it is transport, energy, whether it is agriculture, whether it is healthcare, we should have the environment protection and promotion embedded in the core. This is very important. So the plans should include enhancing the capacity of the health and environmental monitoring also and surveillance system. I think this is important. If we have these monitoring and surveillance system capacity strong within countries to follow up the environmental indicators and public health indicators, this will be very beneficial. So, and I can say, well, if you want me to say what is concerning us, really is the concern really is about going back to business as usual after COVID is over, or within the post-COVID. We are concerned that we continue to subsidize polluting industries that will lead to more air pollution, more dangerous. We think this is an opportunity, and we are concerned that the focus will be on short-term gains only. The long-term results related to environment and its impact on health might be overlooked. So these are some of the concerns that we really would like to share with you.
Fantastic, thank you for those. And it was great you were referencing both that core demand that was in the letter that the health community should be engaged, but also with the more specific ones as well. And I'd just like to say it's an absolute pleasure to have ICN represented. I sometimes tease my doctor friends when I'm I say that, you know, people think doctors are the most trusted profession in the world. They come in second to nurses. So it's a real pleasure to have ICN represented. So thank you very much. So can we now turn to Dr. Ottmar Ploeber, Secretary General of the World Medical Association, and I presume a doctor.
Thank you, Diamond. The World Medical Association is the Europe organization for currently 113 national medical associations, which we represent the physicians to the international organizations, but private and governmental organizations. And we as a physician organization have been involved in environmental questions for quite a long time. The relation between health and environment for most people probably is a no-brainer, just if you think about environmental hygiene, the questions of safe and clean drinking water, clean air, things which have been arising already in the 70s and have been now since then being part of environmental health work that is being done all over. But for the last decade, a little bit more than for the last decade, another thing has come to the forefront of our engagement there, and that is climate change. Because what we have seen quite early in the analysis of what means, or what climate change means, is that every type of climate change brings you a health effect, either a direct or indirect effect. I think there is nothing in climate change that doesn't have to do with health. Whether that is a shift of pathologies, and especially with zoonosis, which we see, whether that is famine that leads to starvation, poverty, and then again to migration with all the health problems that are attached to, as well as starvation, undernutrition, and the migration problems that we see. Natural disasters, which are more frequent now, which we see, which usually have a large number of casualties or injured persons, which we see. And what we more recently also are seeing more and more as a fight over resources, natural resources and even water as an important one, which leads to military conflict, and by that again to health damages. So that is a very pressing problem for us, while we think we have to be engaged and have to exert some kind of pressure and produce alertness in our populations that things have to change and that we have to change. That is something which we see on a kind of a bipolar thinking. One is, of course, directed towards society and towards politics, because the major changes have to be made there, whether that is the use of fossil fuels, environmental practices which are unhealthy in industry, traffic, tourism. And the other part of this bipolar thinking, so to speak, is towards us ourselves, because other than many politicians who think health is just a cost, health is actually, in most of our economies, one of the biggest parts. In my own country, in Germany, it's more than 5 times bigger than automobile industry. So 5 million people earning their money in healthcare directly, compared to a very small group in for instance, the automobile industry, to give an example for that. That means we have also an own responsibility on what we do and how we produce health, use the resources in healthcare. And that is another thing which we are very much looking into. How can we green our own practice, whether that is a doctor's office or whether that is a hospital. And those are examples on which we are working on when we are turning to ourselves, and how can we change our behavior as citizens, but also as an industry and health industry. As such. The beauty of every crisis is that it provides usually at least one opportunity, if not many opportunities. And opportunities here are indeed that we can take learnings out of the COVID crisis, learnings for a much bigger crisis which may be ahead of us, that produced by climate change. And this may just foreshadow damages which we all will experience if we do not change and if we do not act now. And that is why we think we have to make this call to say we have to change. We have to see the connection between the environmental determinants of health and the social determinants of health, which you yourself mentioned already, that it always has to do also with the affluence in a country, with the economic ability to survive such a crisis, and vice versa, with the education to start a new way and to change, really. So we see this as a duo there that we have to take into account. But we are also a little bit skeptical about what is going on now in politics, because we don't see the focus really on a better economy, on a change in economy to a more healthy environment, to a greener economy, so to speak. What makes us hopeful is, of course, that there are examples which are good. And I think in the end, there may be kind of a long-term thinking and the wish that what we have seen now with COVID-19 doesn't happen again. And that gives us some optimism that change is possible and change will be done. Thank you very much.
Thank you very much for all of those remarks. And one of the ones I think perhaps we don't emphasize enough sometimes that you emphasized is just how big a player health is economically. It's about 10% of the global economy. It's probably represented even more than that as an employer. There's no reason for us to be quiet as the health community in these big debates. So thank you very much. I'd like to turn now to Dr. Mauricio Ilabaca from Chile. Thank you to the previous two speakers for being concise, and we will need to keep that going to have time for discussion at the end. So over to you, Dr. Mauricio.
Thank you very much. Colegio Médico de Chile represent 30,000 of medical doctors for 18 million of citizens. We are Chile is a very few country, and we signed this letter because we need to work together globally. The environment is a huge social determinant in health, and is increasing in exponential partner with the climate change. We have to understand the climate change like the next enemy that humanity will confront after COVID-19. And we have to fight against social inequities and impact health. We are very concerned about these last two factors, and we need to fight globally. That's the reason why we signed this very important letter. Thanks.
Thank you very much, Mauricio, and also for being very concise. I think that Chile in general has been very proactive on this issue, including making the links to health and pollution. So I think it's one of the countries that is making these connections. But I think we're all hearing that you're right. We have to work internationally. We have to still be even more ambitious. So thank you once again for your input. If I can turn now to Leticia Rispel from, I think, World Federation of Public Health Associations.
Great, thank you very much, Dermot. The World Federation of Public Health Associations was established in 1967, so we're 53 years old. We represent more than 100 national public health associations, which collectively bring together more than 5 million public health workers. And just to say that since our inception, we've emphasized the values of equity, social justice, and human rights as core values. So the reason that we signed on this letter was that we thought that the letter built on two initiatives that are complementary. Firstly, we're one of the founding members of the Global Sustainable Health Equity Movement, which we launched on the 2nd of July this year. And secondly, in April this year, we signed a letter to the heads of state and government of the G20 countries, where we called for a coordinated, equitable, and human rights-based response to COVID-19, which includes protection of the environment. So Dermot, I'm going to swap your two questions around And I'm first going to tell you what are we concerned about with the current recovery plans, and then I'll tell you what we would like to see in the economic recovery plans to ensure a healthy and sustainable recovery process. So firstly, what are we really concerned about in the current proposals, some which were discussed earlier this year? So I think one of the things that we don't often talk enough about is that the recovery packages are those economic packages that got us into trouble in the first place. Those are the kinds of policies and interventions that actually led to this current crisis. And so we worried that these packages will exacerbate, or the continuation of business as usual will exacerbate inequities. They will encourage profits before healthy lives, and they will continue to damage the environment. So we're also concerned about the conditionalities that are attached to some of the packages, especially financial support to countries. Often they talk about a suspension of debt rather than a removal of the debt altogether. We also find that many of the packages actually talk about pay lip service to sustainable development, and there's no acknowledgement that austerity measures in this current COVID-19 crisis, that especially austerity measures that are directed at social services have long-term negative consequences, both for people, the climate, and the environment. So those are the things that I want to say that we're concerned about with the current packages. And then I'm going to turn to what are those things that we would like to see that's on our, perhaps I won't call it a wish list, because I think we should demand these things. Firstly, the COVID-19 pandemic has laid bare the existing inequities among and within regions and countries. And so now more than ever, the world needs strong global, ethical, and accountable leadership that has equity as one of its key principles, and that protects the needs of vulnerable populations and that actually protect our environment. Secondly, we also want financial policies to begin to address those social, economic, and political factors that drive health inequities, both between geographical regions and countries, as well as within regions and countries. And lastly, I want to remind all of us that health equity includes racial and gender equity and social justice. So governments, corporates, and civil society should develop structures and processes that support health equity and that confront structural and systemic racism and sexism and other social determinants of health, which include environmental determinants of health. Thank you very much.
Thank you. That is a phenomenal intervention. And I think just to reflect quickly on what I see as the strongest message coming through there is that emphasis on equity and justice, and making clear that that's entirely linked with environmental protection as well. It's one of the things I've seen most strongly in the discussion of climate change and health, which changed over time from just a sort of technocratic kind of intervention-based approach to something which says this is basically to do with equity and rights. I have to say it's one of the things that the youth climate movement I think has been fantastic about as well. They've picked this up early and have combined those two messages very well. So thank you very well. And also for the attitude of yeah, let's not ask for it, let's just demand it. With that, if I can pass to Dr. Richard Smith from the UK Alliance on Climate Change. Sorry, Health Alliance.
Thank you. So the UK Health Alliance is an organisation of about 20 important medical bodies in Britain: the Royal College of Physicians, Royal College of Nurses, Royal College of Surgeons, but also the BMA and the BMJ and the Lancet. And we were delighted to sign this letter because the timing is exactly right. It's a very live debate. What are we going to do to get the economy back on its feet? And it's both a tremendous opportunity and a threat. And we have used the letter, and we not only signed it ourselves, we encouraged all of our members to sign it, and most of them did. So we then developed off the back of it some principles for a healthy recovery, and then we've moved beyond that to actions that we would like leaders in Britain to take. And we've circulated this letter to all of the leaders. Not only, you remember that the UK has 4 bits to it, and we've gone to all of those leaders. And one of the things we're asking for is that we've advised, when it comes to investment in business and employment, we've said that every investment should be conditional on measurable performance improvements in relation to health and climate change. And I must say I was very interested to hear about the ESG measure. I think that's something we might build in when we're asking for that. Secondly, we've asked for investment in renewable energy, and we heard from Carla how actually that makes economic sense, and certainly the Bank of England is emphasising that point. And we did, during the pandemic, we had the longest ever period of coal-free production of energy in Britain. And a particular opportunity, I think, is that if we're going to achieve net zero, then we need to retrofit some 20 million homes in Britain, and it would be similar around the world. And I think that's a tremendous opportunity for high-skilled employment, because we think employment is something we should concentrate on hardest. As you were saying, Dermot, it's the thing that people worry about, well, second after whether they can feed their family. Then we've asked for investments in low carbon transport. And we've seen a lot of changes in Britain, as I'm sure people have in other countries. I mean, I live in London, and London is increasingly full of bikes, but now there are many, many more bikes. People are nervous about traveling on the tube, they're nervous about traveling on trains. So people are cycling and walking, and we very much hope we can keep that up. As in all your other countries as well, people are working from home and actually finding they can do almost everything from home if they're knowledge workers. So all those big buildings that fill the centre of London, we don't really need those anymore. We'll no doubt keep some of them. And fourthly, we're asking for investment in a resilient food system. I think the pandemic exposed, particularly at the beginning, the fragility of our food systems. And then also, when it comes to the healthcare system itself, as people have said, in Britain, it's about 5% of all our greenhouse gas emissions. And I've just been giving a talk where I was showing a slide from the Lancet Countdown that looks at health systems around the world, their carbon production. And the horrible thing is that almost all of them are going up. And it's clearly crazy to have increasing emissions from health systems when we're trying to move to a net zero economy. And I mean, to give NHS England, we have 4 NHSs in Britain, its credit, the Chief Executive, Simon Stevens, has committed the NHS to get to net zero as quickly as possible, and set up, and instead of just plucking a date out of the air, which I think people are inclined to do, he's set up an expert advisory committee, which has 2 questions to answer. How quickly can we get there, and what do we need to do in order to get there? And we're hoping to present the results of that at COP26, which was of course going to happen this year in Scotland and now happen next year. Then I would say that we have written to our Chancellor, that's our Minister of Finance, asking him to invest in retrofitting of houses. We welcomed a £3 billion green investment package. But it's not all good news, because we've just had the latest report from our independent committee on climate change, and like so many other countries, we're not reducing our carbon emissions as rapidly as we need to. But to end on good news, we have had in Britain a climate assembly where we've put together a random sample of the population of just over 100 people, and they presented with lots and lots of information on all aspects of climate change. And they have now completed their work, and 80% of those members, so that's ordinary people representing all the different sectors of the British population, support a recovery which contributes to the UK meeting its net zero targets. So we were very grateful to have the opportunity to sign the letter, and we think it's very important, and we've built actions on the back of it. Thank you.
Fantastic. Again, wonderful intervention, and really showing that, yeah, things are moving sort of independently with the different organizations around the world. So Jenny, I'm conscious of time. It's 5 minutes past the hour. We have another 10 minutes scheduled. I can see that there are quite a few questions coming in on the chat and on the Q&A. How would you like to do this? Because we can sort of, there seems to be a sort of a flavor. I can sort of summarize some of the questions in about 4 questions, which we can pitch back to the other panelists. But how would you like to do it? Would you like me to do that, or you to do it?
Yeah, I think our heads are in the same place on that. I think there are a couple of themes. So why don't you go ahead and take it? And I think there are some questions we could also direct back to Carla and yourself and Maria as well, to weigh in if you feel so inclined. So yeah, please go ahead.
Okay, I'll be quick, because I think the interventions were fantastic, and it sounds like we're very much on the same page. So there was nothing that I can even conceive of disagreeing with, but different speakers were emphasizing different aspects of this. From what I can see from the questions in the chat and in the Q&A, people are asking for good examples if we have them. And I think there's a particular premium on good examples from resource poor settings, if you like, where we're having trouble even meeting the basic needs, let alone considering how we protect from climate change. The second is, I think we're getting questions on how we become more effective advocates within the health community. So there was a question, I think, to Dr. Otmar saying, fantastic, WMA has done this. My national organization is not doing very much. How can you help us move the national organization? So how can we completely mobilize, if you like, the strength of the health community? And then I think the final one, at least for me, is how can we be more effective externally? Part of the reason for having this webinar now is because the G20 Finance meeting is going on. These decisions are made, and we've had the letter. We've put our signal out there, but we need to follow it up, and we need to talk about the mechanisms for how we punch as effectively as we can with the weight that we have, rather than just agreeing basically amongst ourselves. So I would suggest we open it up on that basis, basically good examples from countries. How do we organize better within the health community, and any proposals for being more effective as we speak outside. And for the moment, I'll just open it up to any of the panelists if you'd like to just intervene. Otherwise, we can maybe go around the panelists. Anybody like to volunteer and answer on any of those? But Dr. Fatima, please.
You're on mute right now.
I just want to take the opportunity to highlight the work that ICN have been doing to promote the work on climate change and on engaging nurses in public health measures. So one example is that ICN trying to be the global voice for nursing and bringing not only nursing actually perspective, but even people and community perspective through our work as nurses. So one measures is to partner and to be member in societies globally, internationally, nationally. So for example, ICN is a member of the WHO Civil Society Working Group to advance action on climate change and health. This was launched 2019 at the World Health Assembly, and the goal is actually to increase engagement of health civil societies. So so for ICN is this global work, and this is this promotion and engagement of these ideas, and empowering nurses to really help community to be engaged and to understand the impact of climate change and the impact of not actually strengthening the public health measures. ICN position statement on climate change, there is a call to nurses and to national nursing associations to really look at different aspects on how to get climate change on the agenda of nursing in general. So for example, ICN engage, they like our association to engage in national element structural measures when it comes to impact of climate change, and involve national action plans and policies to mitigate mitigation, adaptation, and resilience strategies to contribute to environmental health. And also very important is this, we are always trying to raise the awareness of the health implication of climate change and how to assess and address climate change risk to health by developing policy documents on that subject. Very important that we look at young generation and generation of nurses to come and include the issues of climate change and its important aspect when it comes to public health, and when it comes also to pandemic, is to include these topics in the curriculum and in continuing education, and engage the media to promote public awareness and support incentives for nurses to incorporate environmentally responsible measures when it comes during their work in different settings. So these are just a couple of examples that I wanted to share with you regarding what the ICN is working. In addition to really partnering with many other association and civil service organization in this aspect. And when we come back to the issue of that, we really believe that the focus now in this recovery plan is to engage healthcare professionals and to make, again, as we said, make environmental issues and public health the core of these plans. Thank you.
Thank you very much. Any other interventions from panelists in response to those questions we're receiving? You're free to just...
Can I say something, Dermot? This is Richard Smith here.
Please go ahead, David, and then I think after you.
So me first, Richard.
Please, yes. Thanks.
So we can't claim in Britain to be a resource-poor setting yet, but we do, of course, have people within the country. We know there's greater inequity usually within countries than there is even between countries. And we've certainly, one of our principles is working on that every intervention should encourage more equity and reduce inequalities. Also, one of the things we emphasize to our members is that they all have considerable international networks, and that we urge them, no matter how well we might do in Britain, we're only a tiny part of global emissions of carbon. So we encourage them to work with their colleagues in China and India and Brazil and the US to encourage action. And of course, the BMA is part of the World Medical Association. And I'm sure people here probably remember IPPNW, International Physicians for the Prevention of Nuclear War, which won the Nobel Prize and used that global network of health professionals very effectively. And then as regards messages, I would say that one of the things that one of the founders of the Alliance, Robin Stott, is doing is saying, we in health need to find a better way to get our messages across. And one of the ways we should do that is to work with people who have concentrated primarily on the environment or on nature or on biodiversity. And he's organizing a meeting to discuss, how do we combine our messages? Because I think ultimately, probably the health message, because there's a huge threat to health, but there's also potentially a huge benefit to health, as you said right at the beginning, Deanna, is a very powerful way to engage people.
Wonderful, thank you. Thank you, Richard. Otmar, over to you.
Yes, I want to respond to the question of the engagement of national medical associations or local medical associations or NGOs in general in the healthcare field, how to mobilize them. What is unfortunately a bad idea is try to command them. That usually doesn't work. Neither when we would try this or whether a government would try this, you will get the opposite result for that. That usually doesn't work. However, national medical associations are membership organizations, and it's up to the individuals really to engage in there and to bring up those topics. Now, what we can do as a World Medical Association, we can show it is possible to build zero-emission hospitals. It is possible in conventional healthcare settings, in doctors' offices, to reduce the carbon footprint significantly. So we can do something ourselves on the side of the healthcare industry, if I may call it that way, which is, as we have said already, is a really big part of our economies. So there is a chance for us to do something. But then there is also, as leaders, as medical leaders, as organizations, there is a good chance to have an influence on politicians. Because we are multiplicators, we can talk to patients, we can talk to our communities, we can talk to our municipalities, we can give advice on how to structure development in a more environmental friendly way, how to reduce waste, for instance, which is an important thing in saving energy and cleaning up our environment. But it requires really the engagement of people in the organization. So just complaining about it is not enough. You have to go into the organization and have to really play a role in there, a role to make a change and to mitigate, and not just to be a bystander and saying, oh, it's all too bad. That doesn't happen. So that is something which I can only encourage. And on the other hand, on the global level, there are good examples. There are ways to change. Just one more word to that. On the other hand, we have to be careful. Those who are speaking here are coming all from countries which are rich or at least relatively rich. We are in a position that we can choose what we do. There are still a lot of countries in this world which are so poor that they have no choice. And we have to be very careful not to raise our moral finger and claim a moral superiority over those countries which are in a very difficult situation. So I think we have to be careful with that as well. Thank you.
Thank you very much.
Dermot, can I maybe come in? Because
Please
one
go
of the
ahead.
questions, I think I am from a country which is not rich. One of the questions related to good examples, and I wanted to just comment that it's often a false dichotomy to say, you know, we don't even have enough resources to run a health system, you know, let alone to look at all these, you know, these other aspects. So I think we shouldn't fall into that false dichotomy where it's the one or the other. Often I think it's about stewardship, you know, at government level. Governments, one of their key roles is to provide stewardship, which includes providing stewardship over the private sector. And in many instances, it's a case of what policy choices are made. With regard to best or good examples, I think in every country we're probably going to find that there are small localized examples. And so I want to suggest that also we need to look at how do we upscale those small examples instead of kind of looking for a big bang approach. You know, often it's around chipping away, raising advocacy to raise these issues around healthy recovery, making sure, you know, that we provide evidence not only about what would be the value of a healthy recovery, but also what would be the value of more equitable outcomes, because I think it has benefits for the entire society and not just for vulnerable groups. So I'll leave it at that.
Wonderful. Thank you again for that. And I think I don't know if you're monitoring the chat, both of the panelists and also the other participants, but I think there are a whole series of interesting questions and reactions that are coming exactly on that. I think everybody recognizes that there is the issue of providing basic services, but even in resource poor settings, there are choices that can be made. It isn't always the case that the polluting short-term one is the only one that can that is possible in a low resource setting. And it is about having that political vision that you start from the idea of doing the best for your population in the short and the long term. And often if you start with that, then you will find that the clean development choice is the better one. So I think I'm conscious we've run sort of 5 minutes over time. I will just ask Dr. Mauricio if you have any final comments in the panel session before handing it back over to Jenny. Dr. Mauricio.
Of course, thank you. I agree with other panelists. COVID-19 showed a segmented and fractured health system in Chile, very unequal. And for this reason, we need to include in COVID economics plans and universal and strong public health system with no difference between poor and rich person, rural or urban sectors, common and worker disease. We need to consider really health like a human right. In the case of greenhouse emission, we need to take profits from clean and sustainable energies like green hydrogen opportunities and to promote human mobility because we have a very epidemic of overweight and to continue to fight against the air pollution like black carbon, who continue to be a very high risk for Chilean citizens. Thanks.
Thank you. Wonderful. I can't think of a better closing note than the importance of human rights and the equity approach in dealing with all of this. I hope that those of you who've been following the webinar have been able to see the chat. I think Jen's been doing a great job of posting a whole series of resources that have come from the different organizations represented on this panel. Hopefully we've covered at least some of the questions that have been raised. It's very clear that we haven't been able to answer all of them, although I know that many of the people represented on this call or as part of the community would have answers to these or reactions or would like to continue the discussion. So with that, I'll hand back to Jenny to say where we go from here and how we carry on working together. Thank you.
Yeah, thank you so much, Diarmid, and thank you to all of you who signed the letter and spoke on the panel, and thank you to Carla for your insights from an economics perspective. I think there were a tremendous number of insights shared during this webinar, and also quite a number of questions that people would also like to continue I think learning about. So we hope to continue the dialogue as a community and continue pushing this issue. I think the other thing that's very clear is that we really do have to keep pushing the issue, as was noted by a few different folks along the way, as well as some of the things that people shared in the chat. The countries are not all making the right decisions when they're moving on these recovery packages, including countries that have the resources to make very substantial investments. These aren't all going in the direction we need them to go in order to protect people's health and well-being and health equity and so forth. So we do need to continue to working together. Immense gratitude to all of you for joining us to speak on this webinar. I appreciate and want to express gratitude to everybody who attended the webinar, who are clearly very interested in these issues. I think working together, we can carry this forward. As an immediate next action. There is the G20 Finance Ministers meeting coming up this weekend. Jen has shared a kind of a mini advocacy toolkit that we put together that has some sample tweets. It has a template of an email that one could send or a letter one could send, and links to tables that show the G20 leaders' Twitter handles and the G20 finance ministers and central bankers' email addresses. So if you want to take an immediate action, go to that toolkit and tweet about these issues, write a letter to a G20 finance minister demanding that we need a healthy, sustainable, inclusive recovery. With that, I'm going to wrap it up. Thank you, all of you, and let's continue working on this together.
Thank you.